Hi, I'm Dr. Rajan Sagar from the University of California, Los Angeles. And the question in front of us today is how prevalent is pulmonary hypertension due to connective tissue disease? You can see on the first slide that nearly 25% of all group 1 PAH is related to connective tissue disease. And the important thing here is when you see a patient who has pulmonary arterial hypertension, 50% of that group will be idiopathic, and of the remaining 50%, half of that will be related to some form of connective tissue disease, and this is usually overrepresented by the systemic sclerosis group, which we'll get into a little bit more. Of the associated conditions, there are several, and they're outlined here, and include diseases such as HIV, drugs and toxins such as methamphetamines, portal hypertension, so these are patients with established portal hypertension, which can either be cirrhotic or non-cirrhotic, underlying congenital heart disease, and of course, as mentioned, connective tissue disease. It's important to recognize that systemic sclerosis is not the only connective tissue disease that can lead to pulmonary hypertension, although it is the most common autoimmune disease related to pulmonary arterial hypertension. Other diseases that can be seen include lupus, or systemic lupus erythematosus, or SLE, which represents about 15 to 20% of the cohort of all autoimmune diseases leading to pulmonary arterial hypertension. The next most common is mixed connective tissue disease. Remember, this is a defined rheumatologic disease by the American College of Rheumatology and needs to be differentiated from the so-called overlap syndromes. This represents about 10% of the PAH we see in autoimmune disease. And lastly, rheumatoid arthritis. And keep in mind that all of these diseases can be associated with pulmonary fibrosis as well, and so we have to be careful determining or labeling patients with group 1 PAH versus group 3 PAH, and sometimes this distinction can be difficult. Thank you for listening.